During this surgery, the process goes like this. The first thing we're going to do is we're going to mark the donor area, and then we're going to trim the site where we are going to harvest the hairs. After we've trimmed the hairs, we're able to count the number of hair follicles per square centimeter that you have. This helps us to determine how long of a site we're going to have to take, or how long of an incision site we'll have to take. Next, we numb the donor area, and then we'll excise the donor strip. After that, we'll suture the wound shut, and we'll hand off the graft to our tech, who will dissect the graft into follicular units. We will then numb the recipient site and make small holes in the recipient area for the grafts. After that, our technician will come in and place the hair follicles. During this procedure, there are many people on the staff that will be participating. We have the donor sites being made by myself or my nurse practitioner, and we have the cutting and placing of the grafts done by our technicians. Our technicians have 14 years of experience or more and have extensive training in this procedure. We use anesthesia for the patients, and that is local anesthesia with lidocaine. For people to help relax, we may use Valium, and for pain, we can use Percocet or Vicodin. The procedure typically will last for about 4 to 6 hours for 1,000 grafts. For 2,000 grafts, it will take 6 to 8 hours, and for 3,000 grafts, we'll bring in extra technicians, so it takes, again, 6 to 8 hours. Then we'll bandage you up after the surgery is done and send you home. After the surgery, we go over your post-op instructions. And this will give you the wound care instructions. We'll give you medications that may be required, including pain relievers. We discuss the healing process and the fact that you may have little crust in both the donor area and the recipient area. These crusts should be left alone for the first 2 weeks. After that, they should fall off naturally, or with more aggressive hair washing, they will come off. We like to have you sleep with your head elevated for the first few days to minimize the amount of swelling that occurs. We'll give you contact numbers for the office so that if you have any questions during your healing process, you have somebody to talk to. We'll discuss frequent side effects with you so that there are no surprises. We set you up with a suture removal appointment in 7 to 14 days, as well as follow-up appointments to check on your progress. In some circumstances, further surgeries may be required. This may be the result of changing expectations, progression of hair loss, or you just may want more hairs. The most common side effect that we see is swelling, particularly around the eyes. This side effect can last for 2 to 10 days. Next, we have folliculitis, or just inflammation around the hair follicles. And we typically will see this as the hair follicles start to fall out and then start to regrow. This occurs approximately at 2 months after the surgery. After any surgical procedure, people will frequently experience itch, and this is transient and will go away. Telogen effluvium, or commonly known as shock loss, occurs into the surrounding hair follicles. What happens is when we're making the small incisions to plant the hairs, the surrounding follicles can get traumatized and fall out. This is a temporary phenomena, and the hair will regrow. Next, we have donor and recipient site discomfort. This can last for 6 months to a year, and it's usually very, very mild, so it doesn't disrupt your life at all. Next, we have mild numbness, and again, this can last for 6 months to a year, and it really isn't bothersome in most patients. Next, I like to discuss the less frequent complications that can occur after surgery. The first would be poor growth. Statistically, we find that 90% of the grafts that are placed will survive. Also, there's a small chance of a poor aesthetic outcome. That's why it's particularly important to select a surgeon that has a good reputation and a good aesthetic eye. This is where you may want to ask the surgeon to see their before and after photos or talk to their previous patients. There's a small chance of poor scar healing at the donor site. We may also see a change in the texture of the hair. I have seen hairs that were straight grow curly when they're transplanted to the front of the scalp. There's a small chance of severe numbness, a very small chance that you could get a collection of blood underneath the skin. There's a small chance you could get an infection either at the donor site or the recipient site, and a very small chance that the skin could die or it could necrose. At the end of the consultation, we'll go over the treatment plan together. And this would include if we're going to have them use medications, if we're going to do the surgery. If we are going to do the surgery, we're going to discuss the number of grafts that they need, where we're going to place those grafts, and the number of potential surgeries. We're also going to go over the donor location, and in certain circumstances, we may do blood work. Then we'll review the consent, and we'll also go over the cost. For those of you who are interested in hair restoration surgery, I highly encourage you to come in for a consultation to one of our locations. We have offices in Newport Beach, Rancho Mirage, and Palm Springs. We also are happy to do online consultations as well as telephone consultations. Please visit us at www.contourderm.com.